Welcome to proactivephysioknowledge.com. I am Jamin Bhatt. Today I will share my views regarding how to create a beautiful movement. It is evident that there is an increasingly broader view of optimal motor control for spine stability. The best strategy for stabilization of the lumbopelvic hip complex and the rest of the spine will provide a control of segmental motion and multi-segmental alignment in both static and dynamic situation. So which strategy is best to use depends on multiple factors, which is related to the task characteristic and makeup of the individuals. Increasing in the spinal stiffness is only one possible strategy for dynamic task. It is often not appropriate and indeed can be detrimental. This is consistent with the clinical observation that increasing spinal stiffness is not appropriate for patients who are already using strategies that make them too stiff. Furthermore, increased stiffness in some situation may impair the ability to maintain the desired trajectory in a given task and thus actually make the spine unstable. Still, an uneven broader perspective is one that considers the questions. If the spine is stable, does this guarantee a optimal performance and a function? Or if the spine is stable, does it guarantee that the patient's goals are met in regards to outcomes for the desired task? It is a question. It would seem that many have made the assumption that yes, if the spine is stable, then optimal function is guaranteed. However, stability is only one requirement for beautiful movement and optimal performance. If we look at the literature, in 2007, Reeves and their colleagues said that clarifying terms around spine stability note that once stability of a system is established, the interest shifts to its performance. Unless the system is stable, there is no reason to discuss its performance. All unstable systems perform poorly. It also noted that a common mistake is to assign a level of stability to a system. In other words, to say that one system is more stable than another. To discuss about the stability of a system, whether it is in equilibrium or changing with the time, we must give a small perturbation and observe the new behavior of a movement. If a new behavior is approximately the same as the old one, qualitatively speaking, the system is stable. If the disturbed behavior differs significantly from old behavior, the system is unstable. If the new behavior is approximately the same as old, then system has the ability to maintain the desired trajectory despite any disturbance. According to the Hodges et al. In 2007, they also said that a situation can arise where two patients use the different strategies. However, both strategies provide the stability to spine or a pelvis during a specific task. So in terms of stability, the strategies can be considered equivalent. However, any two strategies may differ in the level of robustness they provide, in that one patient may be able to cope with only a low level of uncertainty. Let's say an example of walking on uneven terrain, whereas the other may be able to cope with greater degree of uncertainty. For that, they are walking on uneven terrain but in a darkness. Therefore, evaluation of motor control involves the consideration of multiple factors that are required to attain the goal of optimal movement without injury and pain. Additionally, stability of a spine or a pelvis is one necessary component, and ultimately performance is related to how the spine or a pelvis function in relation to the rest of the body, how well the task is completed, and whether or not the outcome matches the patient task related goals. That is also important. We want the whole body to perform well. In 2007, Reeves et al. They said that performance reflects how closely and rapidly the disturbed position of the system tends to return the undisturbed position. Accuracy and speed are two main attributes of any control system. While this definition provides a distinct measurable entities to quantify a performance, I suggest that optimal performance is broader than these parameters. Optimal performance must include a parameters that reflect the quality of movement, which allows an observer to state that one performance looks better than another. In summary, science is not yet able to measure this qualitative aspect of optimal function. Still, it requires a research and the performance that allow us to call it a beautiful moment. Thank you for listening. If you like this, don't forget to share with your friends and use the code PPK15 that will give you the discount on my next webinar.